Post-Deployment Cardiopulmonary Evaluation Network is a group of VA physicians with expertise in pulmonary and occupational medicine. We provide comprehensive clinical evaluations to veterans with deployment-related exposures and respiratory concerns or conditions. Through this work, we strive to better our understanding of the relationship between airborne hazards and longer-term health outcomes, identify possible treatments for related respiratory conditions, and improve care for veterans. Comprehensive testing is a key component of our evaluation, but we know that medical testing can be intimidating when you're not sure what to expect.
In this video, we will discuss basic pulmonary function testing, including spirometry, total lung capacity, and diffusion capacity measurements. Non-invasive breathing tests that help your doctor see how well your lungs are working are called pulmonary function tests. There are many different types of pulmonary function tests, but all of them involve breathing in and out through a mouthpiece. On the day of your pulmonary function test, you should wear comfortable, loose-fitting clothing that allows you to breathe freely. You may be asked to avoid eating a heavy meal, using certain inhalers, or smoking a few hours or even a few days before the test. Always follow your provider's specific instructions when preparing for your test. When you arrive, the technician will check your height and weight. Spirometry is a simple kind of pulmonary function test that helps measure how much air your lungs can hold and how easily you can move air in and out of large airways, giving your doctor important information about your lung health. For this test, the technician will ask you to sit in a chair. A soft clip will be placed on your nose to make sure you're only breathing through your mouth during the testing. You'll then hold the mouthpiece of the spirometer between your teeth and close your lips around it to create a tight seal. The mouthpiece is replaced after every patient for hygiene. When you're ready, the technician will guide you through the next steps. First, the technician will ask you to take a deep breath in, filling your lungs as much as possible. And then, as hard and as fast as you can, you will be asked to blow all of the air out of your lungs into the mouthpiece. You will keep blowing as long as you can, often for several seconds, until you're told to stop. This will usually be repeated 3 times to get the most accurate results. For certain tests, you may be asked to inhale a medication that can help relax the airways, called albuterol, and then repeat the maneuvers. After the test, you may feel a little lightheaded for a few moments. This is normal and should pass quickly. Total lung capacity is another pulmonary function test. This measurement tells your doctor how much air your lungs can hold. A common method used to obtain this measurement is plethysmography. There are other testing methods to obtain a total lung capacity measurement, but they will not be covered in this video. The setup for the total lung capacity test is similar to routine spirometry. A soft nose clip will be placed over your nose, and you will be asked to create a seal with your lips around a clean mouthpiece. For this test, however, you'll be asked to sit inside a clear, airtight box that looks a bit like a phone booth. Don't worry, the box has windows and an audio communication system, so you'll be able to see out, and the technician will be able to see and speak with you throughout the whole test. Once you are seated, the door will close gently, but you'll never be locked in, and the technician can open it at any time if you need. To start the test, you'll be asked to breathe in and out normally for a short time so that you can get used to the equipment. You will be asked to gently support your cheeks with your hands throughout the testing. The technician will then ask you to pant, quickly breathing in and out through the mouthpiece. After this, the technician will ask you to take your deepest breath in, then completely exhale all of your lung volume out through the mouthpiece, which may take several seconds, and then inhale again through the mouthpiece. These steps help measure the pressure and volume changes in your lungs. After the test, you might feel a little lightheaded for a few moments. This is normal and should pass quickly. Some pulmonary function testing will include measurement of your diffusion capacity. The diffusion capacity measurement helps your doctor understand how effectively your lungs can absorb oxygen from the air you breathe. Like with routine spirometry, you will be asked to wear a soft clip over your nose and bite down on a clean mouthpiece, using your lips to create a tight seal. At first, you will be asked to breathe normally through the mouthpiece. When you are ready, the technician will ask you to slowly breathe out as much air as possible until your lungs feel completely empty. When you have totally emptied all the air from your lungs, the technician will press a button to start the test. The machine will then deliver air that contains a tiny, carefully measured amount of carbon monoxide, along with normal components of air. The amount of carbon monoxide is extremely small, much less than what you might come across in everyday life, and is completely safe for medical testing. Next, you'll be asked to take a quick, deep breath in, filling your lungs as much as you possibly can. When your lungs are completely full, the technician will ask you to hold your breath for about 10 seconds. After time is up, you'll be instructed to breathe out. After the test, you might feel a little lightheaded for a few moments. This is normal and should pass quickly. Once you complete your pulmonary function testing, your results will be reviewed by your healthcare provider, who will discuss next steps with you. If you have any concerns about the process, you should discuss these with the ordering doctor beforehand. If you have other questions about your test, please visit My Healthy Vet online or contact your local VA pulmonary function lab or respiratory care department.